The upper limbs and lower limbs, trunk, head and neck, are invested in a double layer of connective tissue known as fascia. This follows the skin and lies underneath the skin. The fascia itself is divided up into the superficial fascia and the deep fascia. The superficial fascia being a subcutaneous, dense, irregular connective tissue whose primary function is to allow skin mobility, occasionally containing muscles to maintain skin tone, for example muscles like platysma. The deep fascia, on the other hand, is a tough, collagenous, inelastic structure. It's a stocking that invests the head, neck, trunk, upper limbs and lower limbs as one continuous layer. In this cross section of the thigh, we can see the muscles themselves. There's the quadriceps, the hamstrings and the adductors. That's the femur. And this red layer that we see coming all the way around here is the deep fascia. Superficial to the deep fascia, we have this fatty this fatty tissue that lying underneath the skin. That's the superficial fascia, and then this external layer is the skin itself. The function of the deep fascia is varied. It contains the muscles. It prevents them splurging out. On the deep surface of the deep fascia, we have intermuscular septa. So we have these layers, these sheets of tissues coming from the deep surface and going off and attaching into the bone itself. So there is one intermuscular septum, there is another intermuscular septa, and there is a third intermuscular septa in the thigh. The function of the intermuscular septa are to compartmentalize the limb. They divide the limb up into its relevant compartments. So here we have the anterior or the quadriceps compartment. Here we have the adductor compartment, and this is the posterior or the hamstring compartment. The compartments invariably contain muscles that are functionally organized into the same group. So the quadriceps are the knee extensors, the hamstrings are the knee flexors, and the adductors are the muscles that adduct the hip. The intermuscular septa serve to increase the surface area for muscle attachment. So while the quadriceps do attach to the anterior, medial and lateral surfaces of the femur, right round here to the linea aspera, some of the quadriceps fibers arise from the anterior surface of these two intermuscular septa. The fascia itself also attaches to superficial bony points. So as the fascia is coming down here, investing the quadriceps, by the time it gets down to the tibia, it will blend into the periosteum of the tibia here. Up here, it'll blend into the periosteum of the greater trochanter. Down here, onto the periosteum of the fibula. And consequently, it creates an element of stability to the joints that it crosses. When learning muscles, you will be expected to identify the functional group the muscle belongs to. So for example, here we have gluteus maximus. This is gluteus maximus, found on the posterior aspect of the hip joint. Its functional group is as a hip extensor. That is not its only action, but that's its primary action. You will be expected to identify its form and its classification. And where gluteus maximus has a long proximal attachment and a long distal attachment, this is classified as a quadrilateral muscle. Its general position should be identified. So in the case of gluteus maximus, it's found on the posterior aspect of the hip joint, providing the contour of the buttock. And then in detail, you will be expected to identify the proximal and distal attachments. In the case of gluteus maximus, the proximal attachment is quite extensive. It arises from the gluteal surface of the ilium behind the posterior gluteal line, the borders of the iliac crest and posterior superior iliac spine, the margins of the sacrum and the coccyx, and also from the sacrotuberous ligament. It takes a small attachment also from the fascia covering gluteus medius. The distal attachment, on the other hand, is a quarter of it blends into the periosteum on the back of the femur in an area known as the gluteal tuberosity, and 3/4 of it blend into the thickening in the fascia of the thigh, the iliotibial tract. This is the detail that you're expected to learn each muscle in. From its attachments, you can work out the direction of fibres. In the case of gluteus maximus, fibres pass downwards, laterally, and they wrap around the femur itself. And it's the direction of fibres that gives us the actions. The fact that the muscle lies behind the axis of rotation of the hip joint means that it's going to produce hip extension. The fact that it wraps around the femur means that it will produce lateral rotation of the hip joint. The upper fibres that lie above the axis of rotation of the joint may assist with hip abduction. The nerve supply of the muscle is also important. In the case of gluteus maximus, it is supplied via the inferior gluteal nerve that takes its roots from L5, S1 and S2. Nerve roots will be described in more detail in the next distance learning pack, the Introduction to Neurology. Finally, we would expect you to identify the function of the muscle. This is not merely stating its actions, so it's no good just saying that it's an extensor and a lateral rotator of the hip joint, but we need these actions put into a functional context. For example, extension during the extension phase of walking, or extension during the extension action occurring during going upstairs or moving from sitting to standing. Practically, we would expect you to be able to palpate this muscle accurately.